Hello, I'm Dr. Paul Beckham from All Seasons Full Body Chiropractic Center in Fargo, North Dakota. Today's presentation, I want to go over some hidden things that might not be found that are the actual cause of your problem. I have a lot of patients coming into my office and they're complaining, just like help. First of all, my pain isn't going away. They've been to other practitioners, they've had medications and different other therapies and modalities used and aren't getting the results that they're looking for. And it appears, upon questioning them, that most of the time these other practitioners are chasing their symptoms. Well, today I wanted to go over, at least one of the possible causes that might be causing some of their pain and discomfort and the reasons why they're not getting the results they're looking for. That condition would be hidden myofascial trigger points, maybe the cause of the symptoms. So, one of the first ones I guess I see a lot in patients are upper trapezius myofascial trigger points. People will come into the office, they'll be complaining of headaches or what they think are sinus headaches that just aren't going away. They've even been prescribed antihistamines, which when they take them, seem to help make the headaches go away. But then unfortunately, they come back again and they're on this continual cycle of using sinus, medications to try and deal with their headaches. And a lot of them, after a point in time, that just doesn't work anymore. So once we get them in the office, usually, they're coming in and as you can see kind of the red on the face to the left here, they're going to get that pain. Usually it's in these darker red areas as the primary areas where they're going to get it, although it can be in these more stippled areas here too. A lot of them get that pain and pressure behind their eye, and especially like in the corner of the jaw there too. But where the actual problem's at is out in the trapezius muscle where it's attaching out to the distal portion of your collarbone or your clavicle. And if you were to come in the office, we're going to get you evaluated. We're going to find that if we go and push on those areas, we're going to get these symptoms of your neck pain and headache to be reproduced. If you came into the office with a headache already and it seems to make it worse, technically those would be labeled an active trigger point. If you came in, didn't really have the headaches, at the time when you came in, but when we went to try and find these trigger points and pushed on them, and then it caused your headaches to kind of come back, those are what are called latent trigger points. Those still need to be treated to the point where you just come in this case with the trapezius, where we work on this area of the muscle here, and they just get to be tender and you're not getting the referred pain going up and into the head at all here. That's when we're actually done with the treatment with you there. So for all the patients that do have myofascial trigger points, we're going to use a bunch of different modalities. Some of them are just manual hands-on types of techniques. Some of them we use some different instruments with. Some of them will also use some therapeutic modalities to help knock out these trigger points so that you don't have these problems coming back. We'll probably even try and look at addressing some of the biomechanical issues you have, whether that be through ergonomics and stuff they have going on at home or at work, or literally with your internal biomechanics to make sure that everything is working and functioning correctly. So again, your problem doesn't come back for you. So the next kind of most hidden trigger point that can cause a lot of problems that patients will even complain of, like pain in the shoulder here that even radiates down into the arm and hand. They can even get some numbness and tingling in these areas here. Some of the patients that I've had come into my office, they'll have it labeled things like carpal tunnel syndrome or a radiculopathy or a neuropathy. And when the all actuality, the problem is the subscapularis muscle here, where it's on the front side of the shoulder blade here, and it crosses over where the scapula and then the humerus kind of come together at the glenohumeral joint here. And when this muscle just gets stressed, it's going to give you that referred pain pattern that you see up here in the red. So what we really need to do is get in here, get this area treated. Again, with some of those manual techniques or some of the other modalities to help knock this out for you, so that we can get the cause really fixed here and hopefully keep it from coming back for you again here. So the next biggest one is abdominal myofascial trigger points, where I guess the biggest ones I see are here, like with the rectus abdominis here. People will get trigger points right down at the bottom where the rectus abdominis muscle attaches almost right onto the pelvis at the pubic bone here, as well as where it's attaching at the base of the sternum and the cartilage along the rib cage here. The one up here is literally going to give people pain across their mid back area here in this red area. And people can get their backs treated as long as they want until they get the myofascial trigger points treated here. Again, it's just not going to have this problem go away. Again, if this is active, we'll push on it. If you already had back pain here, it's going to make it a little more intensified. If you came in, it wasn't bothering you today, but then we went and pushed on this and it caused the pain to kind of show back up here again, that is a latent trigger point. And we need to treat it past that point where you come in, it doesn't hurt here. We can maybe work on this area here. It's maybe tender to the touch. That's to the point where, hey, we're actually done really getting this treated. Same thing with the one down here. That would be just right above the pubic bone here. That can cause pain across this lower back region here. Hopefully get it to the point where you are coming into the office, you're not really having this pain. We might still need to work on this here until we get this to the point where we're just literally pushing on the trigger point here and you just get having more tender point there. Occasionally I will have people come in, they'll have some problems like what they call McBurney's point. Typically it's indication of an appendicitis going on. So obviously if you have a fever or just nausea, vomiting, and things like that going on, get into the hospital. You probably need to get that appendix out. If you've already had the appendix out, which I've had happen a lot, I have patients that will develop trigger points here. And as you see, we can kind of work on this here. They'll still feel like they have kind of that appendicitis type of pain. Once we get that trigger point resolved for them, that just disappears. So kind of the last kind of hidden trigger point here is your iliopsoas muscle here, where here's your psoas muscle. It's, as you see, it's on the inside of your abdominal cavity here, more on the front side of the lumbar spine. The iliacus muscles on the inside of the pelvis here, and then it crosses over the hip joint here and attaches down on the femur here. And you can actually get a trigger point right in there as well, right on the iliopsoas tendon. I do have a lot of female patients that will come in and they'll get a little bit of a bursitis underneath where this tendon crosses over the pelvis here. A lot of them have been into their OBGYN and have thought they've had like ovarian type pain. They usually give them non-steroidal anti-inflammatories, which might help deal with the issue there. It can even help with the bursitis here, but a lot of times we'll feel this bursitis in here. I've felt them, even as big as a half the size of a tennis ball. And it's very, very tender to the touch. But once we get that resolved by doing some manual treatment and using some therapies on it, we can have that not come back free again here either. The big referral points, like for the psoas muscle here, it literally, the biggest area that I see people come in, they'll get pain like right over their sacroiliac joint, right at the bottom of their lumbar spine down in here, if you can see where that's circling there. Typically, again, people have been into other offices. They're getting this lower back treated here. You can get that treated till the cows come home. It's not going to resolve your problem. We need to get these trigger points dealt with here. And until we do, this back pain is going to just be a perpetual thing for you here. So the iliacus can give about the same kind of referral pattern there as well. So typically with these, they're very, very deep. And on the front side of the spine, we use a high volt electric stim with an ultrasound therapy to help get in there. It not only helps treat it, but it also helps locate the areas where we need to treat the most. So it's very, very helpful in knocking these trigger points out. So again, that we've gotten down to kind of the root cause of your problem. We've got the issue dealt with. So if you think you maybe have any of these trigger points that we just kind of discussed here today, these are just a few of just dozens of different trigger points that a person could have in their body that could be causing pain in areas where you don't even know what's really causing it. Give the office a call. We can get you set up for initial consultation and evaluation here. at 701-356-0016. Otherwise, you can reach out to us through our website at drpaulbeckham.com and set up an appointment there, or send off a note, and we can respond to any of the questions that you have. So I hope this information has been helpful, and have a great day.